Now we're going to talk about bronchitis and other pulmonary disorders. And for this discussion, you'll be taking on the role of a newly employed nurse going through orientation at a pulmonary medicine center of a large university-affiliated medical center. This is a multidisciplinary center for clients who have pulmonary problems. Using the theater of imagination in your mind, envision our facility with inpatient units, a pulmonary function lab, and of course, extensive pulmonary rehabilitation facilities. We've got lots of clients to evaluate and discuss, so let's cover some of the basics first. Bronchitis is an inflammation of the lungs that can be acute or chronic. Acute bronchitis usually develops as a complication of an upper respiratory infection, such as a cold or the flu. As this type of bronchitis is related to an extension of a viral infection, it can be transmitted to others through coughing, as well as touching someone else right after coughing. Chronic bronchitis is associated with hypersecretion of mucus and chronic cough. It persists for 3 months a year or longer for at least 2 successive years. Environmental factors can increase the risk of acquiring bronchitis. These include smoking, exposure to secondhand smoke, air pollution, and occupational exposure to dust and chemicals. Exposure to these entities damages the bronchial tree, which in turn increases the likelihood of contracting bacterial and viral respiratory infections. Let's compare the symptoms of acute and chronic bronchitis. With acute bronchitis, there are fever, chills, chest pain, malaise, persistent non-productive cough that might progress to a productive cough, back and muscle aches and pain, abnormal breath sounds characterized by diffuse crackles, rhonchi, and wheezing. With chronic bronchitis, there's perioral cyanosis, dyspnea, breathlessness, peripheral edema, persistent productive cough, especially during cold weather, use of accessory muscles for breathing, abnormal breath sounds, including diffuse crackles, rhonchi, and wheezing. Diagnosing acute bronchitis is fairly straightforward and is based on client history. The physical exam may reveal elevations in the temperature, pulse, and respiratory rate. A chest X-ray will differentiate acute bronchitis from pneumonia. The diagnosis of chronic bronchitis is more comprehensive. The healthcare provider must determine the extent of the disease and how much it interferes with the client's life. Diagnosis begins with a comprehensive history and physical. Pulmonary function studies are conducted to identify alterations in expiratory airflow. Spirometry measurements are done before and after bronchodilator administration to evaluate the medication's effectiveness. Cardiac involvement is evaluated with an ECG and an exercise stress test. Let's compare the treatment of acute and chronic bronchitis. Treatment for acute bronchitis includes fluids, cough suppressants at bedtime to promote sleep, antipyretics, antibiotics only for secondary bacterial infection, smoking cessation, rest, and humidified air. Treatment for chronic bronchitis includes fluids, bronchodilators, low-flow oxygen therapy, antibiotic therapy, smoking cessation, pulmonary rehabilitation, and family education, pneumococcal immunization, influenza immunization. As you can see from the symptoms and the diagnostic workup, acute and chronic bronchitis are significantly different. Let's look at the management aspect and see how they compare. Symptom relief is the focus of acute bronchitis, while managing chronic bronchitis is much more involved. A client who has chronic bronchitis needs ongoing support to cope with this disease. For either condition, however, we must determine the effectiveness of treatment. So when these clients come in for follow-up, what would you ask them? How are you sleeping? How are you breathing when engaged in various activities? How are you breathing at rest? How are you managing your oxygen therapy? Are you taking your antibiotics as prescribed? Do you see a difference in sputum color and production? Are you still smoking? What can we do to help you stop? How is this rehabilitation going? Are you practicing your breathing exercises?